Other vein clinics use radiofrequency ablation. We use endovenous laser ablation at VeinCenter, and here is why. My name is Wissam Al-Jundi. I'm a consultant vascular surgeon at VeinCenter. Endovenous laser ablation, or EVLA, and radiofrequency ablation, or RFA, are minimally invasive treatments that are recommended by the national guidelines to treat varicose veins. Both modalities use heat to close the veins, and both are equally effective in treating varicose veins when the pattern is straightforward. However, endovenous laser ablation, or EVLA, has some key advantages, and there are some differences in how they work and how they achieve the results. Number one, EVLA uses a smaller fiber, but also more flexible. On the other hand, radiofrequency ablation uses a slightly bigger fiber, but also very rigid. This means that EVLA has got two key advantages. Firstly, it allows us to get a smaller entry into the skin, but more importantly, due to the flexibility of the fiber, we as surgeons can navigate through more complex and twisted veins compared to radiofrequency ablation. A second difference is that EVLA allows us to deliver different amount of energy each time. Therefore, we can tailor the amount of energy that we deliver according to the size of the vein. Our radiofrequency ablation does not allow us that flexibility. Another difference is that the technology of endovenous laser ablation has evolved with time, something that we haven't seen with radiofrequency ablation. Nowadays, we can deliver endovenous laser ablation with different wavelengths, which allow us to treat patients effectively, but also with less discomfort. There are several research studies that compare the two modalities. Some of the recent studies indicated that EVLA is associated with less swelling after treatment, but also more importantly, one research paper reported less risk of reopening and recurrence after EVLA compared to radiofrequency ablation. This means that EVLA is a fairly reliable technology that provides us also with long-term outcomes. When it comes to comparison between EVLA and RFA, there are several patients that I recall who clearly would have benefited from EVLA over radiofrequency ablation. One example is a recent patient who I had, a lady who presented with complex varicose veins behind her knee, and she was very keen to get rid of them because she was due to celebrate her 25th wedding anniversary. The veins originated from a short, twisted vein behind her knee, and it would have been impossible to offer her RFA due to the short and twisted nature of the vein that's causing her varicose veins. At VeinCenter, we were able to offer her EVLA to that vein effectively, and she came after 6 weeks very thrilled with the outcome. As a consultant vascular surgeon, I had the chance to perform procedures for varicose veins using both modalities, radiofrequency ablation and EVLA, and I could see firsthand the clear advantages of EVLA over RFA, mainly around the versatility and the flexibility of the technology of EVLA, which allow us to treat wider spectrum of patients. At VeinCenter, when the clinic was launched in 2003, we actually used the two modalities to treat varicose veins. But as we saw clear advantages of EVLA over RFA, we started to exclusively offer EVLA due to the advantages observed. So at the end of the day, it's all about choosing the right treatment for the patients to give them the best experience and the best results. and certainly helps them walk out happy. If you have varicose veins and you would like to know more about what is right for you, book a consultation with us and we will look forward to helping you.